Okay, what's insomnia? Insomnia is the trouble of sleeping and trying to stay awake through nights. Episodes may also that could last up to 3 weeks, a short term, or it could be a long-lasting chronics. The causes of it is sleep habits that we learn as a child may affect our sleep behaviors as adults. When we repeat those behaviors over many years, they become more habits. Poor sleep or life habits that may cause insomnia make it worse, like such as going to sleep at a different time each night, um, daytime napping, poor sleeping environments such as noise or light, um, sleeping too much in time while awake, working evenings or night shifts, not getting enough exercise, using the TV and computer or smartphones in bed, using some medications and drugs that can also affect sleep, as alcohol or other drugs, heavy smoking, too much caffeine, getting used to certain types of sleep medications, some cold medicines or diet pills, other medications, herbs, supplements that are by a health care provided by providers or brought by your own. There's the physical, the social, and the mental health issues that affect the sleep patterns, including anxiety, bipolar disorder, certain medical conditions such as Trying disease, feeling sad or depressed, other insomnias that have the syndromes that can cause people with depression seeking medical help, physical pains or discomfort, stress whether it's short-term or long-term. For some people, those stress can be caused by insomnia that makes it even harder for us to sleep. With age, sleep patterns have a tendency to change. So the older we get, the more the sleep insomnia happens. Many people find aging cause them to have harder time of sleeping and having time to wake up.
Sleep on most nights, feeling tired during the day or falling asleep during the day, not feeling refreshed when you wake up, waking up several times a day. People who have insomnia sometimes keep thinking about getting enough sleep. The more you try to sleep, the more frustrated and upset they get, and the harder sleep becomes. A lack of restful sleep can affect your ability to do your daily activities because you are tired or have trouble concentrating. There is also treatment. It is important to know that not getting 8 hours of sleep does not mean you are putting your body into a health risk. Different people have different sleep needs. Some people do fine with 6 hours, some people do fine with 10 or 11 hours. Treatment often begins by reviewing any drugs or medical conditions that may be causing your insomnia or making it worse. Thinking about lifestyle and sleep habits that may be affecting your sleep is an important step. This is called sleep hygiene. Making some changes in your sleep habits may improve or solve your insomnia. Using medicine to treat insomnia can sometimes be useful, but there can be risk. And the antihistamines, the main ingredient over-the-counter pills, may cause memory problems over time, especially in the elderly. Only use sedatives under the close care of doctor because they can cause tolerance and sometimes dependence. Stopping these medications suddenly cause rebound insomnia and withdrawal. Lower dose of certain antidepressants may help. These medicines do not carry some problems with tolerance and dependence like sedatives. It may also help to see a psychiatrist or other mental health providers to test for a mood or anxiety disorder that can cause insomnia. You can use talk therapy, such as cognitive behavioral therapy, to help you gain control over anxiety or depression. A psychiatrist may also prescribe antidepressants or other medicines to help your sleeping problems and any mood or anxiety or disorder that you may have.
Hi, my name is Ingrid. Well, how can I start? I didn't always have insomnia. I noticed like throughout the past 2 years I've kind of struggled to sleep. I guess what kind of has to like affect my sleep a lot is like all the family issues that I have going on throughout the past 2 years. For example, last year or this year, well, all through last year and this year, my uncle, which was like my father role model, went through cancer, and throughout the whole entire school year, I was kind of struggling to how to go to sleep because I would go to the hospital, spend time with him, and the whole time I was thinking about, you know, what would happen to him. Is he going to get better? Because there weren't really high hopes for him. Then as time went by, it kind of like faded away. I would go to sleep towards the day, wouldn't sleep at night, probably get like 2 to 3 hours, 2.5 hours of sleep. But then when I'll come home during the daytime, I'll sleep during the daytime. Then throughout this year, like within the last month, I just found out after not seeing my dad for about 12 years, that he has terminal cancer. He barely came back and he has terminal cancer. So that's kind of been roaming around my head over and over and over. So it's kind of been difficult now because not only did my father role model just die last November, now it's my biological dad that has terminal cancer. So that's kind of been my issue, why I haven't been able to sleep. But what I started to notice is that when before my uncle got sick, was that I used to work out a lot, like ever since like high school. I used to do like track, cross country, and soccer all year round. And when I graduated, came to college, I probably only ran. And right before he got sick, I would still go work out. So I would kind of be drained throughout the day. And towards the end, like towards the night, I'll like just knock out or just fall asleep. As for now, well, now after he died, while he was sick and everything, I stopped working out. I was just worried. I really wasn't getting any type of workout. And it couldn't be the use of drugs or alcohol or anything like that, or smoke, because I don't smoke. I don't never done drugs, and I don't drink, and I don't take any type of medication. So to me, basically, it was personal. So now what I did with my dad, I've gone back to running, working out, Zumba classes. I've been running, I've been working out, walking, jogging, hiking with my mom to get distracted, and that's kind of like helped me like cope with things, and it's kind of been like my stress relief. So what I do is I go do that every day, or throughout the entire weekend, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday. So I'll try to do a little something to get a little tired. So now that I've been doing that a little more often, I do sleep a lot better, way better. And that's actually, that has helped me a lot. So what else can I tell you guys? I don't drink coffee. It's rare, so that really never, that wasn't one of my things. So my treatment was basically exercise. I didn't really try to go for prescriptions or anything like that. It's been going on for almost 2 years.
152 participants, 50 that had chronic insomnia, whereas the rest, 102, were normal sleepers. The first 50 were recruited from a hospital, whereas the rest were recruited through flyers within the community. Insomnia is defined as the predominant complaint of difficulty initiating or maintaining sleep or non-restorative sleep for at least 1 month. This definition comes from DSM-4. The inclusion criteria for CI patients included constant trouble with sleeping, could not focus on daytime activities due to their lack of sleep, and they did not have past or ongoing signs of sleep issues, mental issues, substance abuse, or medical conditions that affected their sleep. The inclusion criteria for normal sleepers, they had no issues with sleeping, They had no past or ongoing sleep problems, mental issues, medical conditions, or substance use that affected their sleep. Normal sleepers were also divided into two groups, high vulnerability and low vulnerability. A bundle of tests were given, such as first PSQI and ISI, to test sleep ratings, CS-D and BAI to test mood ratings, DBAS-16, PSAS, and SRBQ were based on beliefs, attitudes, and behaviors. No difference was made between age or years of education. Scores for the first test resulted in the HV group being higher than the LV group, but there was no difference between the HV group and the CI group.